The anal canal is the terminal portion of the digestive tract, approximately 3 to 4 centimeters long, and plays a key role in defecation and maintaining continence. It extends from the anorectal junction at the pelvic floor to the anal verge, external opening. Key features of the anal canal anatomy. 1. Divisions. The anal canal is divided into two main parts. Upper anal canal, derived from the hindgut endoderm, lined with columnar epithelium similar to the rectum. Contains anal columns of Morgagni, which are longitudinal folds of mucosa that house the terminal branches of the superior rectal artery and vein. Anal valves connect the bases of these columns, forming the pectinate line, dentate line. Lower anal canal, derived from the ectoderm, lined with stratified squamous epithelium that transitions into skin at the anal verge. Landmarks. Pectinate line divides the upper endodermal and lower ectodermal parts. It also marks differences in blood supply, lymphatic drainage, and innervation. White line of Hilton separates the non-keratinized squamous epithelium of the lower canal from the keratinized epithelium of the anal verge. 3. Sphincters. The anal canal is surrounded by two sets of muscles. Internal anal sphincter, involuntary muscle, a continuation of the circular smooth muscle of the rectum, responsible for maintaining resting anal tone. External anal sphincter, voluntary muscle made up of skeletal muscle fibers, divided into three parts, deep, superficial, and subcutaneous, controlled by the inferior rectal nerve, branch of the pudendal nerve. 4. Blood supply, arterial, upper anal canal, superior rectal artery from the inferior mesenteric artery. Lower anal canal, inferior rectal artery from the internal pudendal artery. Venous, upper anal canal, superior rectal vein to the portal system. Lower anal canal, inferior rectal vein to the systemic system. The middle rectal vein forms anastomoses between these systems. 5. Nerve supply, above the pectinate line, autonomic innervation, hypogastric plexus, sensitive to stretch but not pain. Below the pectinate line, somatic innervation, inferior rectal nerve, highly sensitive to pain, temperature, and touch. 6. Lymphatic drainage. Above the pectinate line, drains to the internal iliac lymph nodes. Below the pectinate line, drains to the superficial inguinal lymph nodes. Understanding the anatomy of the anal canal is essential for diagnosing and managing conditions like hemorrhoids, fissures, abscesses, and cancers.